I'm in the suburbs of Chicago area. I teach cooking classes, plant-based. And my question to you is, I come across some people in conversation that don't, they're eating fast food, they don't cook at home. What, in your experience, do you find is the entry point to speaking to people that are eating the fast food American diet to get them aware and interested that there is another way? You don't have to be sick and unhealthy, and it is the food. Most people, when they first hear it, they can't believe it. The second thing is they think it's too expensive to cook at home and too much time. The normal excuses we get. What do you find with your patients are some key things that you help them with, so we all could, in the audience, help others try the plant-based diet and eating more vegetables? What have you had success with?
Success is a relative term. I think clearly it's challenging. I think there's such an emotional component to food that it's hard to change people's minds about food. Also, I was trying to earlier show that there is a setup which almost makes it easier for me, if I'm a busy mom, to gravitate towards the ultra processed foods because they're easy, they're quick, they're ready to eat, or all I have to do is heat it up. And so it takes away some of the time. And at times they can be cheaper. Ramen noodles might be a lot cheaper than actually cooking something, and so it becomes hard, and it's difficult to wag your finger at that mom who's trying to do the best that she can with the little that she has. And so that's why I was trying to bring in, it's not just food, it's economics, it's a setup, or if she has to travel miles to a grocery store and there's a convenience store right on the corner, there's a disincentive. But all of that being said, I think the time that you have the greatest impact on a woman is when she's pregnant. I think that what she wouldn't do for herself, she would consider doing for her child. And if she can see that there's a clear benefit or a clear risk to her child to do otherwise, that's an incentive. But I think a bigger problem is that if you don't know how to cook, if you don't know anything about seasoning, it's just a lot easier to put something in a microwave. And so I think that there's just a number of places where there needs to be adjustments along the way. But the problem is not to point the finger at the mom or the person that refuses. I think that once we get an education and once we see a benefit, then we don't have to do a lot of persuading for others to change.
Thank you. So you're saying the focus should be moms. I think if I would have known this when I was a young mom, I would have definitely done this, but it's getting to the moms at that level. Yeah.
And it's also not only how do you cook, but how do you meal prep? How do you shop for a bargain? How do you plan a meal so that you don't need to run to the store? There's some real there used to be home ec. There's no home ec anymore, right?
Exactly. So we need to teach people the home ec basics.
There needs, and not just for women, but for everybody. We need to know that you can eat well on a limited budget, if you know how to do it, how to shop for a bargain, how to, prepare in advance. So you're not necessarily needing to cook every night. Bringing your kids into that process so that they can see and learn and benefit from it. I think there's just a lot that needs to be done, and some of it is truly basic.
Absolutely. Well, thank you for that, those comments. I appreciate that.
Thanks, Janet. All right. Also, I want to ask a question, Sharon. I just want to add to Janet's question. What's the best advice you can give to people who live in food deserts, where they don't have easy, accessible, nutritious food available to them? What's the best advice you can give to those individuals?
That's hard. You want to find out if there are local communities that sometimes grow vegetables. You want to make them aware of those things, but then it's like, well, what am I going to do with this squash? Or how do I fix this squash? So it just leaves a lot of, the more you do, the more you see needs to be done, and so you need to, does it make sense for me to say you need to get on a bus and travel into another neighborhood and buy this food when you don't necessarily have the fare to do that? And then you don't know what to do with the food once you get it. And so there are just many things that need to happen along the way. But if that would reduce exposure to EDCs, if that would lower the problem with obesity, that might be what's needed in order to reduce maternal mortality. And so I guess if we can make a clear, if that becomes clear, and if that is actually confirmed, because again, this is my hypothesis. If that can be confirmed, then we need to redirect some of our energy, not just in looking at what happened at the delivery and why things went wrong, but what could we have done prenatally to to optimize this pregnancy? And I'm saying food is right there at the top.
Thank you so much for that, doctor. Next, we have Jessica. Jessica, what is your question?
Can you hear me?
Yeah, we hear you.
Okay, great. Wow, it's the first time I've ever called on this show, on this conference. I'm calling from Houston, Texas, barbecue capital of the world. But anyway, what we called to say was we're really enjoying your presentation. And as an older African-American woman, we appreciate the real truth about health conference, having you here, and hope that it can benefit other ethnicities also. And I don't really have any particular questions, but my sister used to have fibroids, but as she got older, somehow they disappeared or something. But how we could have helped her? I'm plant-based myself personally. Is there a way to help a person that's primarily plant-based that you know of, that you experiment with?
So fibroids are fascinating. Again, not enough research has been done with fibroids, but what we know about fibroids is that they become prevalent during a woman's reproductive years, and that's when her estrogen levels are high. When she starts to go through the change and her estrogen level starts to decline, fibroids don't have as much to feed off of. They tend to get smaller and become asymptomatic. Now, tying that back into EDCs, if you have EDCs that mimic estrogen, and you are a woman that, for whatever reason, is being exposed to increased levels of these EDCs, you may inadvertently be feeding your fibroid tumors, which is why maybe Black women tend to be more symptomatic with fibroid tumors. And so what you do will depend on a number of things. It depends on at what age do you become symptomatic? Are you still at an age where you want to have children, or are you closer to menopause? And then all the options start to change. But clearly, anything that could limit your estrogen will limit the feeding of your fibroid. And I do want to say that one of the doctors that I really respect is Dr. Baxter Montgomery. He's a cardiologist in Houston, and he's a plant-based cardiologist in Houston, which is a real challenge.
We know him. We know him.
And his
He's
ability, to reverse cardiovascular disease is nothing short of impressive.